Thank you, Professor Chiari. I work in Khymeia. Khymeia is R&D and digital health company founded in 1988, so we have quite a long story. Our headquarters are in Padua, and our job is to develop and market IT-based high-technology solutions for rehabilitation and telerehabilitation. Today, I will describe you the solutions referring to an ecosystem of IT solutions for telerehabilitation that we call the Cloud with the K, and I will try to explain which have been the most important lesson we learned and the errors that we made and we learned to avoid in at least the errors that we have known to know. So we work and we have partners with, I would say, all the most important rehabilitation hospital and research hospitals in Italy, with local health authorities, hospitals, clinical centers, both private and public, and physiotherapy centers. And right now we have more than 150 ecosystems installed in Italy and in Europe. So just to give you an idea, we have 5 lines of products. I will not spend time here, just to say that we have different lines of products referring to rehab and telerehabilitation systems. All technologies are available for adults and children. All the devices we produce are certified as medical class 1 according to MDR, and all the devices are GDPR compliant. Among the 5 lines of product, today I will focus on the VRRS lines of product that is composed by different machines and different products devoted to different areas of rehabilitation. We have machines like the number 1 and the number 5, the 2 uppermost, that are being used in clinical center and in clinical facilities. I will show you in a few seconds what these machines do. And then we have smaller machines like the number 2, the number 6, that are being used in rehab hub in the hospital or in spoke territorial rehab centers, so in smaller clinical centers distributed in the territory. And then we have a line of products that works together actually, that are specifically devoted to implementing telerehabilitation services in the territory. So just the first lesson we learned, and you will see in a few seconds, is that when we work with rehabilitation, a very important thing we found is to develop devices that can cover as many areas of rehabilitation as possible and as many as possible kinds of patients. Because, for example, if you think about neurological patients, post-stroke patient, multiple sclerosis, but also Parkinson's patients, motor domain or the cognitive domain are not just the only ones. You need to cover, in most of the times, clinicians ask solutions that can cover the rehabilitation needs of the patient across multiple domains, both, as I said, cognitive, motor, neuromotor, speech therapy, postural domain. So we tried from the very beginning to develop solutions that could be modular across all the different domains of rehabilitation in order to cover as many areas as possible. Obviously, it was not easy to do that. So, yeah, our system are conceived as a central system, as a central machines, to which it is possible to connect a wide range of specialized devices and rehabilitation modules in order to cover, so they are modular in the design. And this allows the therapist and the clinical therapist to treat simultaneously many domains of rehabilitation. Right now, we have the VRRS machines cover, we tried to develop them in order to cover as much as possible in the ambits of the neurological, orthopedic, cardiorespiratory, as in terms of support oncological domains. Support for rehabilitation, motor, cognitive, and postural as well. And across these many domains, we have a huge number of different rehabilitation modules that goes from neuromotor skill module, hand and wrist, cognitive speech therapy, postural, cervical spine, and some more specialized in research, more research-related modules, maybe including also the usage of EMG, the usage of isoinertial machines. And just to give you some idea, just to give you some example, this is a very brief video showing you what we intend for a module for neuromotor skills. So we intend the exercises and activities based on augmented feedback, biofeedback, sometimes virtual reality if necessary. No, we use virtual reality, but immersive virtual reality has to be, we learned that it has to be used with caution. And for example, in this case for neuromotor skill, we developed activities specialized for acute neuromotor condition, upper limb, trunk and spine, lower limb exercises. Other lessons we learned, we need to develop everything in order to be adjustable to the patient needs and to the patient capabilities, and adjustable to the progression of the patient capabilities along the rehabilitation treatment and rehabilitation recovery. This, another example about cognitive, we developed a cognitive module with exercises and activities differentiated by level of progression among, including all the possible different cognitive domains and cognitive functions to be treated. This is an example instead of how we develop solutions for postural, both static and dynamic rehabilitation. So we developed activities for postural assessment, exercises, reaching, tracking exercises, weight shifting and weight balancing with the patient standing or with the patient sitting on static or dynamic postural balances. I know I have just a few minutes, so I mean, this is not a comprehensive list of what we can do, but it was not to be meant to be. Then we develop also some more strange but equally effective modules, like for example, this module based on camera tracking systems for facial movement rehabilitation that is being used actually in many clinical centers in order to treat both central-based and peripheral-based issues with, for the patient to perform facial movements. So then, once we developed all this modular device covering all these different areas, lesson, we developed it with clinicians. All the times we tried to develop something without the help of the clinicians for the very beginning, we failed. It was unusable, it was rejected, and now it is clear to us. But sometimes it wasn't at the very beginning. So this was another lesson. Regarding telerehabilitation, we tried to bring all the modules and all the activities we developed for machines in the hospital to machines to be delivered and to be used, and to tools to be used by patients at home. So for example, this is the telecockpit. This is a central workstation for the clinician governing and managing the telerehabilitation services from the hospital. And this is one of the devices that we made available to the patients to work at home. So we have this, we call it HomeKit, it's the commercial name, but it's a case with a tablet and with sensors that is delivered to the patient for home use. And that can be used in two ways. We learned that, another lesson we learned is that once we propose something quite new, like telerehabilitation, we had to be very flexible in order to adapt to the different needs of the patient, of the clinicians, and the needs of the organization of these services to be delivered at home. So, for example, with the devices and the systems we developed, for example, allows the clinicians to interact in real time with the patient with audio-video conferencing and with remote control. And this is something that it is needed maybe 100% of the times for some patients and for some maybe organizations, but also we developed and we have been asked to develop also by clinicians a whole set of services to be used to allow for asynchronous way of working. So the therapist prepares maybe a list of exercises, a list of activities in time, a personalized treatment plan for the patient, and the patient executes it and does these exercises prescribed by himself or herself, and then the results gets back to the therapist, which can adapt the therapy or from maybe to an AI-based system that could help the therapist to adapt the treatment. Then obviously this is not so cheap, so we developed also a cheaper, simpler version of these devices and of this, this way to intend telerehabilitation with the usage of, with a dedicated app for both iPhone and Android ecosystem to do the same activities but in a simpler version. Obviously, we cannot add all the same kit of sensors and devices with just an app, but we are developing maybe an ecosystem of Bluetooth-based devices that can be connected to the patient device and home device. Just few words about the cloud. The cloud is the backbone of the connection capabilities of the machine to a unique ecosystem that allows all the services I've briefly described you to take action. So it's a solution we developed to integrate all the system for rehabilitation, and it allows to access and edit the patient's information from any authorized device. It allows to manage the rehabilitation and training session from any device through web applications for the clinicians and for the therapist. It automatically takes care of the backup of the patient's data, and it allows to share across the networks new exercises and new protocols designed and prepared by the clinicians. It's a very important thing to, and obviously it allows also to gather data for aggregate analysis and research and to access to and to permit different institutions to work together. This is I will not delve into details. This is just an idea of the overall solution. So we have all the system connected to a Azure-based in the cloud platform as a service solutions that provides the clinicians with web applications to govern and to do all the synchronous and asynchronous telerehabilitation activities we have seen before, and to prepare the personalized treatment plans, to get access to the data, to start to do video conferencing, and so on. Obviously, it was a quite difficult task to design everything in order to be GDPR compliant, especially because it was not designed from the very beginning. The cloud was an extension of already existing machines, so we had to redesign in detail a lot of components to make it available, but at the end we succeeded, and I would say we succeeded in making it GDPR compliant and as a viable tool, since now we are partners of the neuroscience Italian network that connects together all the most important IRCCS, so research hospitals that have used this infrastructure to validate telerehabilitation across different kind of patients, Parkinson's, stroke, multiple sclerosis, mild cognitive impairments. We have many different studies going on with that. We have been partners of the European Space Agency, of the USA that funded a project for post-COVID rehabilitation in Milan. And right now we are, implementing many telerehabilitation services together with the always increasing number of local and regional health authorities and public health authorities, with some project already going on, with hundreds of patients being treated with our technology. Our technology are just a tool. It's a way to permit clinicians to do telerehabilitation in ways that otherwise would not be possible, but we are not reinventing the way clinicians perform their task. Okay, thank you for your attention.